Following the outbreak of the coronavirus global pandemic, efforts are being made to prevent movement of people from one country to another. Giboroh is one of the 9 formal entry points to Gambia from Senegal. In addition to the security installation there, a functional health post is available for the management of possible cases of the COVID-19, while Eyeafrica Ibrahim Abba is on Giboroh entry point in the West Coast region. And of course, I'm glad to say he is now on the line. Many thanks once again, Ibrahima, for of course coming through on the line. Now, what does the border closure mean on this spot?
Yeah, like you rightly mentioned that this is Giboroh border point, which is one among the 9 formal entry points to the Gambia from Senegal. So it took about 7 to 10 minutes from the main junction in Mandinaba, all in West Coast region. So if I tell you what we observe, what I observe on the road is like the road is virtually empty. And this is the point where somebody will either get into the Gambia or got into Senegal. So behind me, you could see clearly that the barricade is actively put down. So this means that there is no formal entry. So we've seen some trucks parked around the roadside and police installations are seated at their various locations. So shops are virtually closed. And I mean, this signifies that the border is indeed closed. So definitely at Giboroh here, which used to be a very, very busy time, very busy place, active place, is a point of entry to people going from Gambia to Senegal or Senegal to Gambia, is not the usual Giboroh we knew about.
Well, what is the security saying as to the movement of people and services?
As you can see, we are right now stationed right in front of the security installations. You have the immigration, you have the drug enforcement offices, you also have the police station, and all these security installations are in my left-hand side. The other side is more of shops, which is only few consumer shops operating. So we attempted to speak to the security to tell us exactly what is the enforcement like, what is immigration and movement of people like. But the immigration chiefs and, of course, the police on the ground, understand the norm that journalists, only speak to the PRO, or security do not speak to the journalists. They will refer you to the PRO or to the senior commissioners who we didn't arrange to speak to. So what they could tell us is like, go ahead, you describe what you have to say, but we are not able to say anything as far as our senior officials. We are not consulted as to your coming. And Eyeafrica, we didn't have much time to prepare all these things. This is an extraordinary situation. Extraordinary situation, the health ministry will say, requires extraordinary time. And of course, the movement of Eyeafrica OB1 is extraordinary. So to have all these formalities done is definitely not an easy one. But the beautiful thing is about we are allowed to continue and broadcast even on the heart of the border here, which is definitely showing the pictures of what the reality is on the ground.
Well, that's quite very interesting as you are trying to describe that. Now, is there any other portable entry points apart from the place where you have the security?
Yeah, this is a very major concern that, is being talked about even at the National Assembly. The one parliamentarian member for Tumana said that we know the borders are closed, but Gambia and Senegal borders are porous. This is repeatedly said. And so people could enter informally into the country. So you understand also in the previous press conferences with the Minister of Health, he said that, we asked him as to what are you doing to make sure that the enforcement of people entering is banned. He said, the borders are porous. You can find villages or communities in this country where the home is in Gambia and the backyard is in Senegal, or one part of the home is in Senegal, the other part is in Gambia. So this makes it extremely difficult. But the arrangement at the Ministry of Health is to enlighten people, to inform people, sensitize the community, and tell them as to the merits of allowing people in or out of the country without going through the formal channels. As you know, even Senegalese sometimes were, spotted on the sea to be coming to the Gambia who were, quarantined, compulsory quarantine by the Ministry of Health. So this is to tell you that entry points are so many, but this is just one of the 9 formal ones.
Well, that will lead me to ask, how would cases of informal entry be handled then?
Yeah, so therefore, when we visited the health post, there is a health post here. During the Ebola time in 2012, there was a health post. So today we are fortunate to talk to access one of the public health officials responsible for the management of cases here. So this is Bakari Manga, who is a public health officer. I will just quickly speak to him. But Manga, how are you?
Fine, thanks. How are you?
So Manga will tell us now as to how our case is managed. Could you talk to us about that?
Yes. Here, first of all, since we started working here, we have never seen any suspected cases here. So what we normally do, we have the hand washing basin, whereby whenever the travelers come, they normally wash their hands, and we also screen them. So what we use to do, if you see that one of the travelers, his temperature is high, is above 37 or 38 and above, we normally segregate you, or you separate you from others. We take you to our holding center. From there is where we normally do our necessary screening. So if we see that if we see that we suspect some of the signs and symptoms that manifest or that meet the case definition of COVID-19, we just call 1025 for further clarification.
So you talk about the holding center. So this center, what is the infrastructure or the facilities available there?
Okay. As of now, the protective the PPEs that we normally have here, we have the gloves, we have the nose mask, the hand sanitizer, and we also have the infrared thermometer. That's the one we use to screen people to know their temperature, the level of their temperature. Yeah, and we also have chlorine, whereby if you put water on the tank here, we use the chlorine to mix it. So people used to hand wash their hand through that chlorine water.
What is the staffing like at your center here?
The staffing here, you can I see we are in 4 in numbers as public health officers. One of our colleagues is on this contact tracing, and the other one today is not on duties. So we are 2, I and Nicholas Jata. So we normally have a shift. Yeah, we normally have a shift.
Okay, that takes me to Nicholas Jata, who is also a public health officer. Maybe we ask Nicola, what is the public reaction to your work and to you as health officials on the ground here?
All right, thank you very much. The public reaction to us, our work is very, very important. They have acknowledged us, and they thank us for what we are doing. Sometimes they normally even call us to come and see. Anyway, if we have some chlorine, can you please hire us? We have some community. Most of them they have these basins, but they lack of chlorine. So most of the time we collect some from our office and then pass them. So they really appreciate what we are doing. They even thank us for what we are doing.
Yeah, what is the supply of sanitary materials and chlorine, since the community is also looking up to you to have some of it?
Anyway, our first arrival here, we have enough. So still now we still have balances here that is in our office. So we normally supply them with this chlorine and then nose masks and others. But as of now, there is shortage of nose masks and gloves. So we told them anyway, we are directly in contact with the traveler. So we normally ski them. So the little that we have, we would like to use them. But any that you have, you can call us or you can call 1025.
So, and then so far, what is the pressure on the cases that you managing? Giboroh is a border village, and then the likelihood of people crisscrossing the border is very high. So is there any pressure on your office?
Then before there was a pressure, then the borders were not closed. People were moving in and out. But as of now, since the border has been closed, we only have few people crossing. Those are the people that are normally using the porous roads. So most of the time, the police and the immigration officers do patrol. So as of now, there is minimal movement here.
Yeah, so I get back to Bakari. You are head of the unit as of today because you were the senior on the ground. We know that the ministry and health workers on the front it has been advocated for them to get some, benefits and then some packages. So what is this a lucrative job for the meantime?
Yeah, it's a lucrative job for the meantime.
I mean, where you've been paid extra for facing the risk on this border post?
No, as of now, we are not paid anything. As of now, I can say that we are doing a voluntary job. Because this is our job. We should not wait for people to tell us that do this. From there, I will pay you. Yeah, this is what we work for, and this is what we swear for to the government that we will do our best to work and save our life and the life of our people.
Yeah. Psychologically, how is working on the border post feels like?
It's like for me, it's somehow minimal that. Yes, because if you look at if you want for someone to work extra hard, you have to motivate that individual. You understand? In that one, even if it's not like money issue also, just give the person the courage so that that person will work effectively.
Okay, Nicholas. Just lastly, are you comfortable working on the border? Many people wouldn't want to come to a border zone because if you're in the country, there inside the country will be a challenge. So psychologically, are you able to sleep? What do you think when you feel you are posted here? Not much resources.
When I was fully posted here, definitely I was totally discouraged. Because then when I came here, I said, oh, then before Ebola time, I have worked almost for 3 months. But because of my experience, that's why they brought me here. Anyway, then before the experience that I have gathered from Ebola, that also added onto me based on this COVID-19 screen. So that one have not put much pressure onto me.
So these are two gentlemen among total number of 4 who are posted at Giboroh border post to take care of, cases or possible cases of the coronavirus. In fact, the center they are occupying is a holding center. They do a lot of things like that. So now the question still remains: what are the benefits for these kinds of health workers who are taking the risk to be on the ground, and also the materials that they need to do their job? We've got from Nicola saying that even the community counts on them because in a typical Gambian community, they always look up to a civil servant in the area for a bailout. So these are the questions. We know that more donation and more investment is being planned for the Gambia. In fact, the one that is brought in from China by the Jagma Foundation, in terms of materials, we cannot ascertain as how much is already in a center which is right behind me there. But what we can report right now is that the border in Giboroh here is definitely shut, but that doesn't stop the movement of people. As the day goes by, you can see people, and in front of me, which you, the viewers, might not be fortunate to see, is more people crisscrossing the road. So these are typically in Gambia, but what happens behind me, that is the border after the barricade, only God maybe know. Thank you for that following for us. In the meantime.
Just last one before you go. You were just trying to describe on the movement of people down there. I just wanted to know whether you have spoken to a few of them. How are they trying to cope with the situation? It's generally a very different environment.
So this is an extraordinary situation, I quote again. And when we come closer to people, they stared at us. So even the security to convince them, to have a little chat to convince them that we are from Eyeafrica. If not the OB van level, it would have been difficult. I think people are not very much open up and then the social distancing, when they see somebody, they are not aware. But a few people told us, yeah, this coronavirus, definitely they express remorse. You see it in their faces. So they are hoping that more could be done, that they worry about the public is worried about, complaining as to why must they be locked down. They understand the severity of the disease, but at least to be locked down, your normal life is not going on. So your shops are being closed, centers are being closed. These are avenues where people earn income, so the rhythm of complaint is still active. So much so that it is difficult to see what they are demanding from government other than just let the lockdown stop.
All right. Thank you very much, Ibrahim Abba, of course, senior editor and correspondent of Eyeafrica, for updating us on the situation at Giboroh border point.
Thank you.
Thank you very much. Very energized, Ibrahima, about their speaking. Of course, thank you very much once again for that great update there. Of course, describing the situation on the ground, as you have just heard from him, and quite a very different environment and situation or whatever. Yes, Munyang mu ngi noonu ak Mariam comme ni ngeen ko déggee ci presse wax na gis ngeen tamit images yi ak yooyu foofu nu mel. tëj nañ booda bi ak yooyu dem ak dëkk bi moom wàññeeku na waaye nekkul ne karaj lañ ko def comme noo ko waxee léegi nga am ci ñi nga xamante ne foog ñu def seen dexantu ak loolu lan nga mun a jàpp ci lim indi ci leeral si situation bi nu mel foofu.
waaw am na solo waaye gis nañ ko dem gis nañ def nañ barrière. karnaa di sax. waaw xam naa maa nga def na pexe ba loolu génn. gis ñi log ko waaye xam nga mun nga tëj loolu moom wane na tëj na. pour nit yi nag. ndax ñoom dinañ tëju loolu mooy problème bi. because still naa nu mu tëjee noonu terewul nit moom mun na dem fu mu bugg a dem ñëwaat waaye comme léegi comme moto yeeg yooyu noonu moom daf fi ne lii si luñ gis ni nekk nur na lu nga xam ne moom tëj na already. waaw so loolu moom Giboroh moom seen bés leer na daf fi ne lii leen nag dafa des nag léegi si nit yi seen boppa te foofu tam dafa mel ni nit yaa ngi si biir because ñi few people ñoo nekk di. cross si gannaaw Ibrahima di dem ak ñëw. so dafa mel ni ñoom tam ñu ngi comply lu nga xam ne ni moom la government bi joxee di ñu stay at home. ñoom it waxee nag seen income moom itam comme ni ko Ibrahima waxee si mujjantali kàddoom dafa mel ni ñu bëri ñu ngay joytu comme ni ko Komba fii di joytoo ñoom itam. because am na ñi nga xam ne foofu la amoon bitik. di jaay ñi nga xam ne ñu ngay jógee Sénégal di ñoom even di security themselves ñoom si seen bopp sax dinañ feel loolu because sinon.
ku xam yoon bi da nga xam ne foofu def doon busy ku fay jaar yu bëri da ngay gis ne business bi léegi def dee xala bëri nit ñi dañ dee dajaloo ak yooyu waaye dafay gis ne système bi yëpp a change so mu ngi laa wax ne boo bëggee wax ak ni sax daf lay xoolaat di la bàyyi xel balaa nga koo jege ak yooyu so loolu yëpp ñu ngi koo bàyyi xel da nga gis ne beneen système la ñoo dunda jamono ji am
na solo di jaajëfal tam ñi nga xam ne ñoo fa toog di yëngatu si mbirum health muy ñaari ndaw yooyu noonu ñu ngi leen di jaajëfal parce que ñu ngi def liggéey bu am solo ak coordinateur ni ñu ko waxee si loo xam ne ni daanaka seen volontariat nga yu bëri jógee gut si ministre yi dem àggagu si ñoom waaye ñu terewul ñu ngi xaar seen boppa di xaaraale tam askan bi loolu nekk na lu am solo te loolu doomi réew bi nekk te war na mun a taxawee noonu leen bu dimbal ñëwee fekk leen fa tam fekk ñoom ñu ngi woon ci kawam waaye tam ñu ngee ñaan tam because ñu mel noonu aajoo nañ ko ñoom itam soxla leen dimbal bi pour ñu gën a mun a taxaw askan bu fa nekk leen gën a set
Mariam just quickly lan nga ci mun a indi ci luñ déggee ci presse
waaw lii moom sant yàlla la because comme nit ñi dafa mel ni waa OPSA ñoo gën a jël li seriously dan ñu nekk si urban areas yi so which means it's a positive sign ne comme rural people yi nga xam ne ñoo nekk si border bi because foofu la spread bi di gën a bari ñoom ñu ngi take precautions so it's a wonderful move daal from the people of the rural area.
Alright mu ngi noonu gis ngeen situation bi nu mel foofu ci Giboroh border bi diggante Gambie ak Sénégal su ko defee li nga xamante ne mooy ñu dem su ko defee ñu balaa ñoo continuer rek ba léegi ci loolu te tamit xam nga ne léegi booda yu mel noonu gis nga gaa yaa ngi noonu ci borom rayda yi ñu ngi taxaw fii boo fi ñëwee léegi rayda yi ñoo la dee jël.
lii moom nañ ko de.
waaw waaye
nee na karaj de wala.
karaj nag caabi baa ngi noonu di kanaar gi nga gaa ngi taxaw ci beneen boor bi. léegi moom xanaa su fekkee am na ku xalaat lifin rek fekk si leen ñu foofu ñu mun laa yëpp si reeda bi yóbbu la. so ñooñu si biir Sénégal lañ nekkee noonu. gaa ngi noonu ci biir Gambia gis nga Gambie ak Sénégal lu ñoo wax.
waaw Giboroh moom si Gambie la.
waaw
den fanaa police station yëpp ñu ngi fa dama xamul ndax Sénégal loolu laa bëggoon a laajte. ndax Sénégal tam am nañ fa lu mel ni.
non Sénégal moom da ngay waaw Sénégal moom da ngay dem ba si kanam ñoom foofu la seen gaay foofu lañ nekk déedéet du Kafountine fàtte naa Sileti ñoom Sileti lañ am seen waaw ñoom foofu lañ am seen check point si waaye bu Giboroh moom Gambie foofu nga am immigration bi police bi foofu la ñoo checké yëpp soo jógee waaw
leer na because bi staba bi mu doon wax yaa ngi gis police immigration jaar na gannaaw
waaw exactement
laa woon ne ba pare ñu bëri daal si service bi
soo jógee Gambie foofu ngay jaar balaa nga mu ngi noonu foofu moom moo nekk li nga xamante ne mooy immigration bi waaw ñoom fii ngay dem ñu liggante say mbir say kayit laataa ngaa continuer dugg Sénégal boo jógee tamit Sénégal balaa ngay dugg fa ngay jaar ñu liggéey say mbir balaa ngay dugg ci biir Gambia.
ñoom
waaye système bi fu mu nekk nii xam naa ñoom
seen dentité yi.
waaw
wax naa bëriwul tay di ko seet.
déedéet.
ma xool seen dentité yi tay liggéey boobu nekkul di dox xam naa.
waaw waaye ci mu nekk lu am solo parce que tamit réew yëpp ñoo jël dëggal yu mel ni dem ak dëkk bi diggante réew ak réew dañ ko tëj because lii mooy yaatal li nga xamante ne mooy coronavirus bi lii moo koy yóbbu gannaaw di ko lawal daal. soo buñ defee jéego yu mel ni nekkul ne bul sonal nit ñi ne waaye pour aar nit ñi la tamit xam nañ ne lii dana affect of course activities nit ñi seen business ak yooyu waaye tamit fexe ku ne fi nga nekk nga yem fa ba ñu contrôle situation bi moo tax ñuy def dogal
lu am solo te nu mu ko déggee ngay wax ak Mr Ba dafa mel ni da ngeen ne bi fii mooy juróom-ñeneentali buntu bu nga xam ne nit mën na koo jaaree dem Sénégal nit mën na koo jógee Sénégal ñu dugg si Gambie
exactly
kon bu ñu gisee taxawaay bi mel ni itam sécurité bi taxawee ko ni nekk na lu am solo wax dëgg yàlla fii tëj na te yëpp a ngeen a selaw ñoom itam ñu ngi xaar rek ordre bi nga xam ne xamaa naa ñoom fañ leen de jëlee cop xam naa ne mais bi am nañu fa am jabar ak yooyu
non loolu dañ koy rek liggante ne nguur la ñoo liggéeyal xam nga loolu moom waaw gis nga mu ngi noonu ba léegi foofu ci Giboroh border point bi diggante Gambia ak Sénégal fii mooy li nga xamante ne mooy border bi mooy frontière bi kon niñ ko mën a waxee Mariam gis nga tamit presse mu ngi doon wax ne gars yi ñu fa dëkka ñu ngi wax ne daal yëf yi métti na parce que miinuñ ko
waaw métti na kay Amadou because comme border la te foofu noonu comme mostly border si luy seen trade mooy nit ñuy dugga si lu ñoo jënd ak yooyu mostly loolu la day nekk du dee nekk si ay farming wala business li fi ñëw comme petit business yi la ñu nga xam ne foreign na si ñoo ñëw dugga si comme loolu moo dee may xaalis border point si so comme nuñ tëjee nii dafa métti ñoom because comme xam nga Gambia especially yeneen dëkk si dañ dee am comme Wellingara Gambia Wellingara Sénégal yooyu noonu nga xam ne comme dëkkay dañ daf dee nekk bii nag melul noonu dafa mel ni Giboroh kese la ko wax
fii yoon bi trog yu bëri léegi da ngay gis fekk ñu bëri ñu ngi rang fii nii fii la ñoo jaar dugg ci biir Casamance dem Kafountine Ziguinchor Bignona ak yooyu yoon bi ñu bëri fii lañ dee jaar dem so
ak sebi passagers yi dem Siliti waaw yooyu noonu yëpp bu ko am na bundu garage sax nga am na Siliti
exactly
yëpp waaw yoon bu doon
moto yi jógee bundu nag ñu bëri ba fii lañ laa indi Giboroh fii ñeneen ñi tamit dañ laay yóbbu ba Sileti su ko defee foofu ngay yem so situation bi daal mu nekk li nga xamante ne mooy comme noo ko doo waxee rek ñu bëri miinaguñ ko te xam naa dana am ay jafe-jafe yi nga xamante nañ ko dunda si jamono ci seen petit business yi ngay wax noonu ndax loolu lañ yaakaar tamit bu fekkee dem ne nag ba loolu amatuk foog mu métti